why I'm here is that I want to share my experience, which started all with this one piece of porcelain veneers. And that was back into early 80s. And in this lecture, I just would like to share with you my thoughts, concepts, techniques that I contributed to our profession in my 35 years of dental career. So, while seeing cases like this, even in this huge magnification, it's impossible to detect what is a veneer, which one is a crown, or whatever. It all takes an amazing ceramist, like Christian in this case, to build a crown, copy-paste per se, or in more complicated cases, just working with implants to see that this single tooth, if you're using the right implant, right techniques, right technicians, you can achieve results like this. This is basically copy and paste type of cases. But when it comes to bigger cases like this, we're not only talking about an interdisciplinary approach, but we are also talking about designing the whole stuff. Because if the patients wouldn't like this end result, doesn't matter what you'd spend on placing the implants, augmentations, prepping the teeth, whatsoever. So, talking about smile design, this is my case. This is my case in mid-80s and my very, very first veneer case. And when we look at it with the face, that was the outcome. And the unfortunate thing is that this is the patient which we have seen like 5 years ago. He's still happy with this smile. The thing is, in 80s, there was nothing such as seeing the thing before we start. So I was thinking, well, I'm just prepping the teeth, sending it to the lab, and this is what I get. I thought that was it. But I was thinking on the other side that even in a simplistic architectural design, they were giving you some plans, they were giving you some 3D sketches, and through that, I said, why don't I apply this into the mouth? I was doing direct composites those days, and I said, instead of just bonding them, why don't I just place it over the mouth, see the final design, and continue with that? So this brought us step by step over the years to my three steps, which without them, I would never ever touch any veneer case. So the first step was the direct mock-up. I realized that if I deliver this to the patient, then I will have a base to start to my cases. So setting the incisal edge, designing this as a direct mock-up, immediately I would accomplish my step one. So what was step two? Step two was to convert this in a more finer design through the wax up. So when I would have this wax up, this would bring me into my second huge step at those years, as I named it as the APT, the aesthetic pre-evaluative temporaries, which refers to, instead of using this just for the provisionals, using this well in advance before we start the case. So with my final design, I would be able to share with the patient the final outcome, the design, the phonetics, occlusion, whatever you name, and get the approval of all these things, and then start to my treatment. And at that stage, this is before the patient is anesthetized, before we even touch the teeth. So that brought me to the third step, which I believe most of you are using, is that out of this APT, besides the aesthetic check, what I came up as an idea was to why not keep it there when we start prepping the teeth. So doing this, I would use that APT as a very solid reference and start prepping it, and that would give me the most minimal invasive occasion to finalize my preps. And as you can see here, in some parts, we don't even touch the tooth, and in some other parts, there are some very minimal preparation with this technique. So, prepping through the APT, being minimally invasive, always getting the right depth for the technician to layer up the ceramics. In this case, we're using the Emax with an incisor layering technique. Christian was doing the ceramic work those days. And finally, this is what I came out with, the 3 basic ideas until early 2000s. And with the book we published, The Science and Art of Porcelain and Laminate Veneers, I incorporated all this knowledge into this book. So after that, how did we proceed? Well, basically, we should have a workflow, either digital or analog, but we should have a workflow. So it starts with the collection of data, the communication between the patient and the dentist, the design part, and then the rest is like more technical treatment planning and treatment itself. So for me, amongst these all things, treatment session, number 1 goes into where the design is, step 1. Step 2 is in between treatment planning and treatment. And step 3 is the prep part, is during the treatment session. But what I will focus today, as of the whole lecture, is what we did throughout the years with that mock-up. So first things first, it's all about visualization before we start the case. And we cannot just talk to the patient that I'll do this like this, I'll give you triangular shaped teeth, I'll make your teeth more longer. It just sounds, but we have to show it to make her see and believe in what we're doing. As an analogy, let's say you want to order flowers to someone. Okay, so pure. But when it comes to details, you'll see that there are thousands of different shapes in flowers. And besides that, if I want to be more specific, I can tell you that there's a flower purple and orange inside. Can you imagine it before seeing these pictures? Or if I tell you there's a flower that looks like a bird, and another one white but transparent, what does it mean to you until you see that these are the flowers? So take those like individual tooth shape that you want to incorporate into your smile design. And on top of that, are we done with this? No. Besides that, now we have the full configuration, how to bring them all together. So this, in a way, is the way we create our smile designs. So I would say never start any procedure without visualizing the final result. And that holds true with simple veneer cases, complex implant cases. See where you're heading to before you start. Another issue is that seeing is completely different than just looking. The more knowledge you have, the more you will start seeing things in depth, the details, and all this stuff. 5 before cases. They all have their aesthetic problems of their own. And these are the 5 afters of these cases. So why did I select these cases? Because it all created this wow effect in those patients. They loved it for some reason. And now in the bottom you'll see the afters of these cases. Well, nice. We've all been seeing these cases, beautiful cases, in this week. But now when we want to focus on that, tell me honestly, how many of us paid attention to the incisal edge configuration, whether it be rounded, triangular, or flat? Or the tooth axis, whether it be straight or inclined. And then the dominance of the centrals, the individual tooth shapes. So as you can see, in a split of a second, I can tell you so many variables that creates a smile design. So the question here is that how to decide on what to choose. Well, that make us think about it over the past 15 years, and this part which I shared with the friends amongst us in Hawaii is that we took this as a reference, the personality traits of Hippocrates being strong, dynamic, delicate, and calm, and then followed by Carl Jung's theory of that no matter what the background of these people are, their religions, cultures, whatever, there are some signs which means the same all around the world, such as the vertical lines representing strength and power, horizontal lines, stability, inclined lines, dynamism, and rounded lines, suavity. So the interesting thing was that even those were categorized on the same 4 models: strong, dynamic, delicate, and calm. And in the psychoanalysis vision, these are the figures that represent these outcomes. It's not our finding, it was already in the literature. And then Philip Holloway was the guy who converted into an art form, and he used these shapes for those faces to be perceived as strong, dynamic, delicate, or calm. So when he would use a square face, this personality means, or perceived to be as a strong facial outcome. So he came out with this Visagism concept, and on top of that, when we follow the same lines, we can see that this also can be seen in the individual teeth. We can have all these designs and the teeth disposition when we analyze the smiles. So our concept was a combination of the visual language that Carl Jung came up, combined with the perception portion of how we can implement this into the faces or into the smiles, and at the end, its reflection on our smile designs. Now, as you can see, Visagism is all about a person's sense of identity. Now, you see a male on the left and a female on the right, but I would tell you that this is the same person with a different way of presenting himself. So you can have something perceived completely different depending on the person's wishes. Look at these pictures and the other sides. So they are almost completely different, but this is all about how a person wants to be perceived. And in a smile design, now it's in our hands to deliver this kind of a perception to our patients, if they want to look strong, dynamic, calm, whatever. And for this project to go on, we consulted lots of psychologists, neurobiologists, anthropologists, and sociologists, and tried to find out the relationship between the facial outcome, personality, and the design of our smiles. And of course, we made lots of mistakes, or trial and errors. To be creative, you have to do it. But the art form is knowing which ones to keep. So with that, we came with the art of a personalized smile design, which will perfectly fit to this patient's desires. Our project started with Braulio and Adriano back in 2004. Out of the 600 plus full mouth cases we have done, we selected like 100 plus of wow effect created the smiles. We put them into fragments and tried to find out the relationship between all these things I mentioned in the beginning of my lecture. So which patients get flat incised edges, which patients get rounded, which patients get triangular tooth, which patients get square teeth. So with that, we came out with a chart after 12 years, which all get this whole information together and their relationship between the facial analysis, the personality of the patient, and their wishes. So you don't need to now focus on that, just to let you know that this is the background of our story. And then we simply digitize this, we put it into lots of algorithms, and we placed literally hundreds of combinations of all these different mixtures, because nobody is pure strong, pure delicate, pure dynamic. It should be a combination. And after that, we started treating cases with this concept. So with the concept, the first thing is to realize the facial perception of the patient. So the software does it automatically. A questionnaire which will reflect the personality, and finally the design will come up to you just like this. And in that, what you will be seeing is that after this, before and after pictures, you'll see that everything was given to me with the software, just by the facial perception and the personality test. And what did I get out of this picture? Well, I got how the incisal silhouette should be. I got how the dominance of the centrals should be. I got how the inclination of the tooth should be, and the shape of the teeth should be. And this is how I got to the final design, just like, not just by guessing that, hope it would be a great case. So if I can walk you through this case, for example, you'll see that this is a trauma case. And there is a huge space to be filled. And we don't know how the previous teeth was, and that needs to be filled by us. So it's our duty at least to start this case with a mockup. So nice, but how am I going to do my mockup? Shall I use dominant centrals? Shall I use medium dominancy? Shall I use triangular teeth, square teeth? So just by getting this patient into the software, I can easily now see that the face is mostly perceived as delicate in this case. And then with the interview, we can see that the patient's personality is also delicate. So I'm just showing these two together, saying that not every patient gets the same design. Of course, other patients get like this square teeth, less dominant centrals, etc. And this is how I start to my mock-up with the visual image of the design that was given to me through this software. So how I would do this, I would imagine that the incisal silhouette will be slightly rounded to triangular. The centrals should have medium dominance, and then inclined tooth axis, and finally triangular to trapezoidal tooth shape. So with this in my mind, it's so easy for me to do the mock-up. I just fill in the blanks. And with that, I already get a design that will be almost 90% representing my final design. And it goes to the lab. If you're so sure with this, you just use this as a wax-up. And finally, you get this patient the same day from left to right. And then when the porcelain crowns are returned, it follows completely the same design that we were given with the software. So when I would like to, and this is just monolithic, just external staining with our in-house lab, Özhan. So when I match these two things, the design and reality, and superimpose them, I will simply see that, yes, this is the design given to me, and this is exactly the copy of what I was trying to accomplish through my mock-up, wax-up, and the porcelain veneers. So it's from left to right before the mock-up and the final design. Now my life gets so easier. Now in this case, do I use it only for simple veneer cases? Of course not. This is a case referred to us by an orthodontist, missing laterals. Thanks God he opened some space for that. We didn't have much time because this, the patient who used to be a model has been offered a great job offer actually, and we had very limited time, like 6 to 8 months. So even though we can see that there is a nice place set up for the implants here, even though it was not the ideal, it was very narrow, I would start to think about how we can treat it, or if we can treat it. And as in every aesthetic case, my startup point would be the incisal edge position. So here, I'll go with the Visagism concept, analysis of the face, interview, and in combination of all these things, this is what I get. Immediately, this comes out in a second. So what it tells me is that the structure should have rounded flat incisal silhouette. We have to have straight tooth axis, medium to dominant centrals, and as the tooth shape, it should be a combination of calm and delicate, which is square blended with round. So this is the ideal way to design her teeth. But when it comes to her case, she already had the braces. So how am I going to proceed? Well, at this case, I'll be using only the bottom side of my design, the incisal 1/3. And through that, I will take my flowable and just try to set the incisal edge silhouette, the zone, and the length of my centrals. So it looks great. The patient loves it at lips at repose. But of course, at this stage, the more she smiles, it doesn't look that pleasant. Now we take the braces out, knowing that this case would work, and time for me to do my second mock-up. So now I have a free canvas to work on. I know the design. I'm just mimicking what we have done with the Visagism and bringing it into my mock-up. So this is the case, and it's a very challenging case because we have less bone. The distance between the centrals and canines are very, very narrow. The decision was to place 2 implants, MISB3s, between for 7 and 10, soft tissue augmentation, and veneers from 4 to 13 after the whole work. So now lab is mimicking exactly what I have given to him and what the Visagism was given to him, working with the line angles, with the individual tooth shapes, and then delivering this back to my office. We're making the impression of the wax up, filling it with Laxatam, placing it into the patient's mouth, and boom, in a split of a second, now I have the design. Well, why is this design so important for me? Because I'll do all my planning prosthetically driven. Look at this zenith point. With this design, this zenith point doesn't only mean me the vertical positioning. It means to me buccolingual and palatobuccally. So we need to position it exactly right, because from now on, with all the planning of the case, I'll use that as a reference. So if you want to have a guide, and I can tell you that 99% of the cases we do with the guides, here you can see that you need 3 portions to send. The STL file of the original teeth, the STL file of your wax up or mock-up, and the CT scan. Only with that, you can precisely position the implant aesthetically and functionally, and this is how the operation goes. Eric, who wasn't with us today, is doing the surgery. He's taking the soft tissue graft, opening the drills through the guide, and then Junaid takes over to expand this minimal bone, not to lose any extra bone chips, and then simply we are placing the implants in here, which Nitsan mentioned with the triangular shape, which gives us the best stability and vision in that area. And I believe, even in the hands of best implantologists, without a guide, it would be very hard to navigate an implant into that zone. So again, as we are working on the chair side for the provisional after implant placement, Eric is trying to build up the soft tissue to the level buccolingually that I wanted through my design, prosthetic design. And this is what he's filling up. And in 4 months, we get a very, very acceptable result. So all we need to do is to transfer this into the laboratory. We're working with an analog way. We're making the impression of the socket as well as the position of implants. And what Hilal does here is that he prepares me an abutment in the shape of almost like a crown. Why? Because I want all my restoration finished as a veneer. So in this case, in the prosthetic phase, what I'm going to do is I'm again apply my 3 steps, which is a must. The beginning stage, second APT, placing my wax up over the unprepped teeth, and third, prepping through the APT. And just because to be minimally invasive, and you can see how little we prepare the teeth, and the reason why I'm so paranoid about it is just behind this article we recently published. We made a 12-year retrospective study dividing the preps on preps limited to enamel only, preps into dentin, and preps over the root surface. But even though the average was 33% success rate, when the preps were on dentin, the success rate comes down to 68. Meaning a veneer out of 3 will have some problems in the next 12 years. However, if we left it on enamel, we would see the success rate is almost close to 99%. So I fully agree with Silas that, okay, we can bond on the dentin, but bonding on enamel is something completely different. So with that token, after I prep the teeth, just like now, converting an implant case into a very simple veneer case, Hilal is doing the final wax up, which is the same design of the Visagism smile, and using, again, the Emax ingots, but just making a incisal 1/3 cutback, doing the micro layering technique. And with that, we're done with the veneers. So this is after the positioning of the veneers. And this was how I started with my Mockup, the flowable composite. And this is exactly what we achieved with the porcelain. So it's always copying the same things, going to the design that we created the first day throughout the whole therapy. The difference is that now, the more she smiles, it looks better and better compared to where we started from. It's a nice smile design that she loves. Its integration is, in my opinion, very well accepted. And these are the steps that we've been through: before, after ortho, and after implants and veneers. So what happened, it was not only the way we were happy, but she was extremely happy because she got to get the job she was offered before we started this case. And she became the face of Max Factor. Now she's really enjoying the smile, just like you all deliver to your patients as well. And it's never a one-man show, it's always a teamwork, so I need to thank to all my team members in my office for giving this case perfectly for us. Now, what is new? New is the Rebel. Rebel is the way we converted this Visagism smile into a very, very simple and easy form. Now, what was I doing until now? I was doing the design, direct Mockup, based on the design given to me by the software. Yet, even though it was digital, what I was doing in the mouth as a Mockup was pure manual. And I know that not everybody feels comfortable to deliver the Mockup manually the first day, because that's the first time the patient will see what you can deliver. And if it looks ugly, the patients will refuse the treatment. So with the Rebel, what we tried to achieve was that we succeeded to convert this 2D design into a 3D design. As you can see here, Now both the design and the wax up is digital. And you'll be receiving the STL file immediately to apply it to the patient's mouth. So this 2D design was wrapped up with the polygons to be brought into a 3D design. And while doing this 3D application, we also use artificial intelligence, meaning that in the beginning, if you paid attention on how we selected the teeth, it would be either square, triangular, or ovate, but it will be a combination of, like in this case, square being more influential and rounded shapes. So even though we have these different shapes of the selected ceramists all around the world in our digital library, plus the natural teeth that we loved, through this artificial intelligence, it will not only select the tooth, but as you can see here, it will morph it into different blends so that we will be getting the ideal form for this design. So with that, this is our patient that I want to wrap it up with. And she has some issues like spacing. And the decision first was to start with ortho, bringing those lower anteriors in, uprighting the centrals. And doing this, as we're about to coming to the end of ortho, now we stop for a second with the centrals positioned perfectly, and we wanted to continue with Rebel. So what do? We take a full face picture of the patient, we load it into the software, and immediately we get the facial perception. In this case, this is a dynamic face. Then we go into questionnaire, and when it's completed, I get another reading about the interview. And now the software will immediately blend the facial perception with the personality traits, and then, like split of a second, will give us this 2D design. Well, this was not enough for us. So what we added only is for you to make a mock-up on a central, even one central, and not with the best shape, just indicating where the incisal edge should be. This is the startup of all the aesthetic procedures. So once you do this, even if the patient has braces, no worries. So this brings me to my first step, mock-up, but mock-up in a very, very simplified version. Again, all you have to do is to decide on the length of your centrals. Then you will scan it with whatever scanner you have, and this is the scanner, and then we will have the interview, and we will have the full face picture. And that will be the simplistic package you'll be sending to Rebel digitally. So once Rebel receives this information, what happens is that immediately it gets this 2D design, overlaps it with the actual teeth of the patient, and as you can see here, it goes on with the morphing procedure on which tooth to be selected, and then converts it to 3D, and immediately we get a design that has been digitized in 3 dimensions to be sent to us. And the beauty of this software intelligence is that, let's say even if we have braces, we can work in a resective design, which means it can exclude the veneer, the braces out of the design. And this is extremely helpful, for example, if you have some rotated tooth. In the ideal situation, I needed to trim it to put my APT on, but here you can exclude this. Now, at this session, how am I going to apply this into the patient's mouth? Well, I will be asking to get a fragmented design, which will only give me the STL file of the incisal edges of those teeth. So what I'm getting here is that instead of this full frame design, I'll be getting this semi-incisal 1/3 design as an STL file. And what I'm going to do with this, as soon as I receive it digitally, is that I can immediately put it into any CAD/CAM machine. Here I'm using the Telio. This is the STL file. These are the milled, say, prepless veneers. Why do I need it now? Because I want to think about how to continue with my orthodontist. Now, when I position those, as you can see, it tells me all the things that need to be done orthodontically due to my 3D design. What does it tell me? It tells me where to position my lateral, mesiodistally. It tells me where to locate my, again, lateral buccolingually to be minimally invasive. And also it tells me about the incisal edge position versus the original tooth length, which will give me the thickness of the veneer. And to be supportive, I need to decide on whether to move the tooth vertically up or down. So with all these things, we continue with ortho, and knowing the shapes that the software is giving us, I know that for this lateral, I'll be using this triangular shape. I know the zenith point. I know the tooth axis. And this is what I guide my orthodontist to position the tooth. And all of this is being done for the sake of being minimally invasive. Thanks to Nuno giving me this final design. And now I don't need to do anything. I'll just ask from Rebel the final 3D design STL file. This time I'll be 3D printing it instead of using CAD/CAM. So I'll 3D print it in my office. I'll make the analog impression of this. My index is ready, and now I'm ready for my second stage. What was it? The APT. And I can see it there with all pros and cons, but most of the time, trust me, patients love it. So that was so easy for me to go. Brings me to my third step, prep through the APT for minimally invasive approach. As you can see, I'm fully on enamel, almost no preparation. And this is what I call minimally invasive. So what did we do with this last concept? In the Chairside, we made a full face photo. This is as simple as that. And then we made the intraoral scan of the two centrals, just simple mock-up. We made a personality test, which is guiding you step by step in the software. And we got the individual request, whatever you want to add. So then, in the Rebel lab, we get this into 2D smile design, immediately converted to 3D STL file. And this STL file is sent to us digitally in our offices. So just before we see the patient for the final appointment, we have two ways to go. Either, as we did the first incisal 1/3 provisionals, we can go CAD/CAM and place the APT like this, or we can 3D print it, make the analog impression, and then apply this into the patient's mouth, just like we see on the right bottom corner as the APT. And from here on, once the patient verifies the aesthetic outcome, then it's so easy. I prep through this as my third stage, make an analog impression, just like in this case, use pressable Emax, for example, and this is the final bonding in the patient's mouth in this case. I can tell you that without me doing anything, if I can get a result like this through a software with an artificial intelligence relating this design into the facial appearance and personality, I'd be very lucky to work on with this system. So with that, what I would say is that if you're interested, for those of you who have been into this meeting, if you send a message to info@rebel.dental, you'll have a free trial just to see how easy life can be. And in my last 30 seconds, if you would ask me what is next in my portfolio, it's very exciting. 3-4 years ago, when I was mentioning this, it was like, oh, he's a dreamer. But now we get the report of a doability report of the whole project, which is to convert what I have been trying to explain to you into a much more easier way, which is the patented intraoral robotic device. So as you go through this sequence, it will prep the teeth for you without you doing anything. And you won't need any impressions. Same time, it will be producing your veneers chairside. So in my last lecture of my life, thank you, Michael, for inviting me here. Thank you for giving this extra minutes so that I could pass all this information to this group. This group, I feel like being at home. It's I don't know how many times I lectured in front of you. So I feel very privileged to be a part of this family. Thank you so much.